So the unfortunate reality today is that radiologists are really overworked. The number of images being produced by CT and MRI scanners has been growing exponentially. Yet the number of radiologists that we have has been more or less stagnant. As a result, radiologists are spending less time analyzing each image, and there's a lot of information in these scans that is currently not being utilized. Radiologists rarely make quantitative measurements, and they tend to focus only on looking for gross abnormalities and diseases, and they rarely make preventative healthcare recommendations. When I was at the National Institutes of Health, I worked on a number of tools that can perform automated extraction of biomarkers from any abdominal CT scan. Using these tools, we can get measurements of things like bone mineral density, how much plaque you have in your aorta, how much visceral and subcutaneous fat you have, your muscle volume and muscle density, your liver volume and liver fat, and many other things. On the basis of these measurements, we can compare your measurement with the measurements of other people in your age and gender cohort. And then we can make personalized health recommendations to help you prevent diseases in the future. So for example, we could tell someone, hey, you have low bone mineral density, so you should consider XYZ supplements in order to prevent osteoporosis. As another example, researchers at Calico Life Sciences have recently demonstrated how a deep learning model can segment out how much plaque you have in your aorta from a standard DEXA scan, which is a common type of X-ray used to measure bone mineral density. This measurement of plaque provides a level of risk prediction for cardiovascular disease, which is almost equivalent to specialized measurements of coronary artery calcification. So, on the basis of this sort of measurement, we could tell someone, hey, you are 45, but you have the amount of plaque in your aorta of someone that is typically 75 years old. And hopefully this sort of information would encourage people to make positive lifestyle changes. So there's a lot of low-hanging fruit for AI in radiology. I've talked a little bit about biomarkers and risk prediction, but of course AI can also be used to try to catch things that radiologists often miss. And of course, AI can be used for cancer screening. But the reality is that few hospitals today are actually using AI, despite hundreds of AI algorithms having been approved by the FDA. One reason for this is that they lack the infrastructure and the expertise to deploy AI and the software to visualize and interpret the outputs. But the more fundamental reason is they just don't know how to pay for it. So I want to suggest a different model that may allow for AI to get into the hands of consumers faster. And under this model, patients would download their scans, which they have the right to do so under HIPAA, and they would upload them to cloud-based AI services. So for any entrepreneurs out there that are looking to deploy AI in radiology, I want to suggest this as an alternate way that you can realize revenue faster and get AI into the hands of consumers faster. And for anyone out there who has recently gotten a medical scan, you may want to consider asking for a copy of your scan. You may get this scan on a CD-ROM, but at least you'll be ready when the AI services in the cloud come online. Thank you.